Professor Abhay Karandikar, Secretary, Department of Science and Technology, Government of India, for his insightful talk.
Thank you. Honorable Member of Niti Aayog, Dr. V.K. Paul, Dr. Rajiv Ahuja, Director of IIT Ropar, Mr. Ashwani Mahajan, Mr. Mahik, Dr. Suchita from ICMR, and all the distinguished guests. I think you just heard Dr. V.K. Paul, who has given a very comprehensive review of all the three aspects. One, what the learnings that we had during the COVID-19 pandemic, which actually led to development of several innovative technologies, including, of course, the largest vaccination drive in the world. And then I think his focus on preventive healthcare through the technology interventions, and finally the opportunity that exists in the primary healthcare scenarios. I just want to add two more things. One thing is sort of very clear that was emphasized by Dr. V.K. Paul also, that for a country of our size and scale, we can only provide in a scalable way, affordable healthcare only through the effective interventions of technology in a right and appropriate way. And also, not only that, but also the next generation research in healthcare is also increasingly happening now, more and more at the intersection of science, technology, and medicine. And therefore, it is even more important that the medical scientists and clinicians have to work very closely with the technologists and the engineering professionals. And in this context, the medical devices, both for treatment and diagnostics, is a very important area. In fact, for our country, it is expected to be a very big market of order of $50 billion in another 2 years. And most of the medical devices and technologies today are imported, which is actually leading to a huge cost, and therefore, in many tier 2 and tier 3 cities and smaller hospitals are not able to afford and deploy those technologies. And therefore, there is a definite need for making sure that not only we focus on the translational research, but also have a system where these technologies can be commercialized. In order to do this, there was a mention of technology incubators. Of course, the DST had taken this initiative of setting up the TIMAT, which was the Technology Medical Device Incubators, in our own institute of Shri Chitra Tirunal Institute of Medical Sciences and Technology at Trivandrum, which is a DST institute and very well known for contributing to several biomedical devices and technologies over the years. The DST, along with the DRDO, has also been having a Society for Biomedical Devices and Technologies, which has also developed several innovative products. And we have also funded several incubators in IITs and IISc, and also the technology innovation hubs, which have been focusing on the medical devices and technology. So now, in the last few years, while we have seen a significant resurgence of activity in the research and technology development in the medical devices, the fact remains that in the health sector, the development of the devices and technologies has a very long gestation period, not only in terms of preclinical and clinical trials, but also getting regulatory approvals and then finally deploying the products. And therefore, one of the major challenges that the innovators and the startups face is in the form of availability of a patient capital which can actually be catered to a long gestation period in the medical devices industry. And that is something we really need not only in the medical devices sector, but generally in several other deep tech and the surprise sectors. The other aspect is, using technology to work on the preventive healthcare system. Now, the aspect of the preventive healthcare system is extremely important because given the fact that of a country of our size and where the patient-to-doctor ratio is low, the number of hospitals and medical colleges are also low, we have to also make a conscious efforts to reduce overall disease burden. And that can only be done if we take some significant steps in the preventive healthcare. And that can also be done not only in terms of addressing other aspects in lifestyle changes and environment, but also in early diagnosis of the diseases which can be then cured much faster than requiring a large tertiary cares. And that is where I think Dr. Paul already mentioned, for example, he gave an example of health checkups, also the detections of the breast cancer, but there are hundreds of ways in which the preventive healthcare system can be developed through the effective technology interventions. Finally, I think I should make a point that in our country, we have been always saying that the medical doctors and clinicians have been largely working in isolations and have not been working with the basic scientists and engineering and technologists. There is also, therefore, a need for the medical doctors also to get trained in some of the engineering and technology aspects, given the fact that now we are also having the increasing use of artificial intelligence and machine learning in diagnostics, also the very advanced radio image processing, and so on. It is also very important that the clinician with engineers and scientists to develop innovative technologies. Given the fact that in recent years our country has emerged and developed a very strong ecosystem of startups which have been focusing on very state-of-the-art technology, I am confident that if we bring a collaborative interdisciplinary approach where the doctors can work with our engineers and innovators, then we will be in a position to provide a leadership role in the medical devices and technologies and make that kind of a contribution at the global scale. Finally, I think I would say that the use of artificial intelligence and machine learning is really going to change the landscape of the healthcare and in general, and including the medical devices as well. Given the fact that our country has a potential of generating large data sets, this could be really an ideal platform for developing novel foundational models for artificial intelligence and healthcare that can not only be effective at the national scale, but will also be able to contribute at the global level as well. Finally, I would really urge that this is really the right time. We have the right enabling environment. Dr. Paul has already spoken of the medical devices policy, the PLI schemes, the very vibrant startup ecosystem. The government will also be coming out with a deep tech policy. We have also seen it in the interim budget, an announcement of setting up a 1 lakh crore Anusandhan fund, which can actually be useful in such sunrise sectors, which, as I mentioned, required a long gestation period and therefore the patient capital. So we have an enabling environment, and I really urge that all the clinical faculty and medical scientists, if they can work in a collaborative fashion, in an interdisciplinary fashion, with engineering professionals and the basic scientists, I think we will be able to create disruptive innovations in the medical and healthcare industries, which will not only help our country but also at the global scale. Thank you very much.
Thank you so